This is Health Tracks, and I'm Peter Graber. Dr. John Magnum, a family physician from Sanford, North Carolina, was installed recently as president of the North Carolina Medical Society during its annual meeting in Winston-Salem. Dr. Magnum is the latest family physician to serve as president of the society and follows a long list of family physicians, including most recently Hickory's Dr. Alan Osbar and Charlotte's Dr. Darlene Menzner. The Academy was able to capture Dr. Magnum's installation speech. The following footage highlights some of the key thoughts he shared during his inaugural address to society members.
I, John Magnum, do solemnly swear to carry out the duties of the office of President of the North Carolina Medical Society to the best of my ability. A specialty organization, North Carolina Academy of Family Physicians, is also well represented this evening, and I appreciate their presence. The North Carolina Medical Society has a rich history of addressing many complex and challenging issues facing medicine, and bringing together the collective wisdom of our members from across the state and from various specialties to do what is best for healthcare in our state. Few of those issues over the years have been as complex and divisive as the issue of national health system reform. Our nation has been torn by the debate. Physicians have been torn by the debate. As of today, we're exactly 7 months into the Patient Protection and Affordable Care Act, and exactly 10 days from Election Day. Now, whether the law remains intact or gets altered substantially by the next Congress, we're in a period of massive change. In my address to the House of Delegates tomorrow, I'll address with them how the Medical Society has dealt with national health system reform, both the debate and the implementation. We have a responsibility to help shape healthcare for our state and our nation, and our board takes that responsibility very seriously. Our profession has faced many challenges in recent years, from managed care intrusion into clinical decision making, to reams of paperwork and excessive documentation requirements, to an unbalanced professional liability environment that leads to high liability insurance costs and defensive medicine, to a federal government that refuses to fix a flawed formula that determines physician payments under Medicare. In spite of the frustrations of practicing in the current environment, in spite of the uncertainty of national health system reform over the coming years, I still consider it a privilege to practice medicine. It is still rewarding to work with individual patients one-on-one, to hear their stories, meet their needs, and help them improve their health and their lives.